Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Hello, everyone, and welcome to the special edition of This Just In Radio. I'm your host, Justin Barnes. Today, we're broadcasting live from the 2024 Georgia HIMSS Annual Conference in Atlanta. For those that may not know or remember, a group of us worked hard about 15 years ago to prove that Atlanta was the health IT capital of America. We had over 300 health IT focused companies in the Metro Atlanta region and are still a very vibrant community today. That's why there's almost 500 people here at this annual conference. Welcome back to This Just In Radio Show, broadcasting live from the Georgia HIMSS Annual Conference here in Atlanta, the health IT capital of America. Very excited to introduce my next guest and good friend, Chris Kunney, healthcare thought leader and managing partner from IOTECH Consulting. Welcome to the show, my friend.
Hey, man, it's good to see you.
It's great to see you.
Always good to be in the Georgia HIMSS conference every year and network and get some great thought leadership. And thank you for having me on the program today.
Always, my good friend. So before we dive into all the good stuff, tell me, first of all, what did you think about this morning, the program? The lunch was fantastic.
Yes. I'm, again, so excited to see the turnout we had. We had well over 600 people participating in this year's conference, which is exciting. The thought leadership that we've gotten so far this morning, especially with the folks from the NFL Alumni Association, talking about the impact of healthcare through the use of sports medicine. And just some of the experiences that the athletes had and talking about their own patient journeys as well too. I think a lot of times we take for granted what they do on an ongoing basis, how they sacrifice their bodies, and the impact that technology is now in helping them improve their lives after the game as well. So it was a very, very insightful conversation.
Yeah, actually, it's probably the most impressive from a certain chapter standpoint, a HIMSS chapter standpoint, probably the most impressive luncheon or keynote I've ever seen, to be honest. That was extremely insightful. We talked about how AI and generative AI is going to influence sports medicine, and the health of not only our sports athletes, but also us as patients in general. But yeah, it's a very unique perspective that they took to the athletes and having them also speak about their futures and all that. So I agree.
No, absolutely. I think sometimes we forget how broad and wide healthcare and healthcare technology really is. And it touches everyone's lives, even athletes. Not only just from the delivery of care, but the data and insights you can get from the use of technology like AI and generative AI. So again, showing that as an example, I think inspires all of us to continue to stay committed to this industry. Very
true. And also, I want to say special thanks to you, Christopher, because you're on the board of HIMSS. You're extremely active for years and years and decades and decades now.
Yes.
So you brought a great program.
Thank you.
So thank you very much, my good friend.
And
also, before we go further, you also have an awesome podcast. Straight Outa Health IT, correct?
Yes, that's correct.
Thank you. Give me a second or two about that.
Sure. So one, I followed this man's footsteps. And he's got big shoes to fill, but you actually did inspire me to actually go down this path. Straight Outa Health IT is what I call kind of an unfiltered conversation about healthcare. I like to call myself a recovering CIO who's been a part of the healthcare industry as on the provider side, now as an advisor and a vendor on this side, as an advocate as well. And so Health IT, Straight Outa Health IT is an opportunity and a platform to allow people across the healthcare ecosystem to talk about their own personal journeys in healthcare and the things that they're very passionate about. So I'm so excited to have now celebrated my 50th episode. Looking forward to the next 50. Looking forward to having you on the program as well too. And thank you for giving me a chance to do a shout out.
You got it, man. No, excited. Love it. I listened to it. I love it.
Thank you.
So we all, we hear a lot of good and bad and a lot of bad stuff from time to time. But I'll just start off, what's very positive? So what progress do you like to see or that you're seeing in healthcare or digital health today? What progress?
It's interesting. That's a great question. And you and I go way back, decades, literally.
Yes,
We're at the very beginning phases of the adoption of things like electronic health records in this industry.
Yep.
And I think what's encouraging for me as I look around this room in terms of the types of companies who are now committed to healthcare and healthcare technology. I'm looking over here at AWS and NTT and several other companies that 20 years ago weren't actively engaged in the healthcare ecosystem, but are really starting to help transform the industry. And I firmly believe that disruption in this industry is going to come from companies who have not traditionally been a part of it, because they bring a different perspective, a different lens, and they're bringing best practices from other industries into healthcare as well too. So I think for me, that's one of the more positive things I've seen, is just the growth and commitment from companies and industries and startups that are now haven't been non-traditionally a part of this industry, now are helping to influence it tremendously.
Oh, great perspective, great point. So what kind of either healthcare or digital health trends should we be looking out for in 2024 and certainly coming into 2025 now? What are you seeing out there?
That's a very good question, and I'm sure you've probably had a number of people already on your program today talking about AI and generative AI. So I'm not going to beat that dead horse.
Some people are staying away from it now. So
exactly.
For
all the aspects. But I tell you, there's an industry that's really starting to emerge that I think folks have starting to think about, and that's age tech or silver tech.
Love it, yeah.
When you think about, I just turned actually 60, believe it or not. This year, I'm the last of the baby boomers. And so every day, 10,000 people are turning 65 for the next 25 years. By 2030, there will be more people over 65 than under 5 years of age. By 2050, 1/4 of the entire world's population will be over 65. So this is an emerging industry and an emerging market where what are we doing to prepare for people who are now moving into their senior years? In fact, there's about 75 to 80 million people in the United States that now qualify for Medicaid. What's going to be the impact economically on healthcare? What's going to be the impact on the delivery of healthcare? And now by 2030, 40% of the physicians' patients will be over 65. Are they fully prepared to deal with all the issues associated with people as they get older? Whether it's congestive heart failure, diabetes, all these comorbidity issues, traditional things like hip replacements, knee replacements, all the other things that take place when you get older. The industry is not fully prepared to deal with that shift that's going to happen. And technology is going to have to be a big component of that, because we're not replacing those folks who are getting older, who are in healthcare and now retiring and moving on. We're not creating a pipeline of professionals who can now be prepared to handle that volume. And technology is going to have to, again, be a big equalizer to support that. So I see that as an emerging market, an emerging industry that we all are going to have to get our arms around, especially people like yourself who are probably a part of the sandwich generation.
Absolutely.
You got older parents, you got younger kids, you're right there in the middle. How are you managing their care as an advocate? Again, technology is going to be a big part of that as well.
I've had to do that for my 98-year-old grandmother.
There you go.
And my son, my host son. All that. Absolutely.
So I see that as an emerging market. Value-based care, I mean, we've been talking about this for a while.
A couple decades now.
And again, I think as we get older, we're starting to realize we got to figure out how to keep people as healthy as they can, as long as they can, because the healthcare system is just not prepared to deal with the influx of people dealing with a myriad of comorbidity issues. And so hopefully the mindset is starting to shift around that, and finding a business model that allows organizations to be sustainable while they deliver and focus more on the health part of healthcare and less on the care part of care. And then finally, I think, when we look at what's going on in the industry, we've got to create a better pipeline of professionals. We've got to look well beyond our traditional individuals that have been in healthcare and tap into places and demographics that we may not have normally doubled down on. So more minority communities, more women in healthcare, more other groups that have not necessarily been a traditional part of healthcare. We got to support those groups because we don't have enough people. The reality of it, but we've got enough people to deal with it.
Correct.
We just got to double down and commit to and foster support for those folks moving into this space as well.
I love it. You bring up some good points, and certainly on your last point around costs, and you made me think, my brain started to fly. Very simply, people cannot afford to be chronically ill.
To
be chronically ill is so expensive.
Absolutely.
They literally cannot afford it. They barely afford to get sick.
That's
never
right.
mind be chronically ill.
Absolutely.
So they really got to think about, and that's where value-based care and taking care of yourself,
Exactly.
finding out those different models that you can possibly afford, or hopefully be able to afford down the road if something were to happen to you.
That's right. Right now, it's about healthcare is about 18.5% of GDP. Yeah. If it gets to 22%, no industry will be able to support healthcare. Right. Not even your employers.
Right. No, it's
it'll
scary.
be the ultra rich that can support healthcare or pay for healthcare. And so we have to figure out how to stabilize that and start to flatten that cost curve.
Yeah, absolutely. So what are a couple thoughts? I mean, you covered some really big points, but is there a couple pieces on best practices? So you're giving, you're a thought leader, giving some advice out there. What would you say are a couple good steps to start, best practices to navigate some of those trends that you're seeing out there?
Oh, that's good. I think first and foremost, organizations have to start thinking about healthcare as a utility. No longer can we focus on healthcare as a capital exposure. Mm-hmm. It is the cost of doing business now.
Right.
And we need to start looking at how do we move away from investing all the capital or debating about the amount of capital that we need to spend in healthcare to moving it to more of an OpEx model. We buy it as a service. And so whenever possible, how do we move away from owning technology to leveraging technology through service models, infrastructure as a service, security as a service, analytics as a service, helps to drive that cost curve down, allows us to scale based on where we need it, and not invest in technology that we may or may not see the full total cost of ownership over time. And so I think that's a model that I know I've been advising my clients on, is start thinking about IT as a utility and less of a capital expenditure or way to control and manage security and privacy and all of that. The reality of it is that most healthcare systems can't afford to maintain the infrastructure necessary to protect the data anyway. Yeah. So you need to work with partners who've already built that infrastructure and hold them accountable for the scalability, the security, the privacy of patient information.
It's fantastic, very insightful. Yeah. So thinking about on the final minute or so,
sure.
What do you have as a key trend that people got to be thinking about navigating in 2 to 3 years from now? I know that it's very hard because it's a lot going on in the industry, very complex. What do you advise people or tell people to be, hey, look out for this?
Yeah, again, I go back to the age tech, silver tech piece. I mean, that's an emerging trend that's happening, and we're going to have to start thinking about doubling down on that. And we have to start thinking about how we continue to deliver healthcare out of the four walls of the hospital into the lower cost, environments, whether it's patient-centered medical home or virtual care or telemedicine types of technologies. How do we start focusing on passive monitoring so that we can do more predictive analytics and predictive care so that people don't start entering into the healthcare system when there's an episodic event?
Right.
How do we prevent these things from happening? I think are some of the emerging trends that I would focus on as well. And then again, I encourage other industries who have not been traditionally a part of healthcare to continue to come, bring those best practices, bring that disruptive approach, and challenge us, our healthcare leaders, to say, why wouldn't we do it a little bit differently than we've done in the past?
I love it. Fantastic. Christopher Kunney, thank you very much, my friend, for joining the show today.
Pleasure.
Congratulations. All that everything.
Thank you so much.
Thank you. Welcome back to This Justin Radio Show, broadcasting live from the Georgia HIMSS Annual Conference here in Atlanta, the Health IT capital of America. Very excited to introduce my next guest and very good friend of the show. You've heard his voice here a couple of times in the last few months. Mr. Tony Nunes, Senior Manager, Healthcare and Life Sciences from AMD. Welcome back to the show, my good friend.
I am very happy to be here, Justin.
I'm very happy. And you just flew in from Europe, right?
I did. I tried to get ahead of the storm that unfortunately, hit Georgia, Florida, Tennessee, North Carolina. Yeah. Very bad business, but got here safely.
But you got here safely. So, first of all, I know you got here, this morning. But anything stand out to you so far on the conference that you like?
Oh my, yes. I'll tell you what. I've traveled to a lot of regional HIMSS events and organizations. This is by far the largest and best organized that I've experienced. So kudos to the folks that run the Georgia HIMSS chapter. It's fantastic.
Good. Well, one of the board members just left and got up. But it's a great crew, great group. I'll give them some special praise too later because this is a great event. That keynote lunch was fantastic.
I thought so too. Yeah. It was really interesting. And you know what? It goes to the heart of something that I've seen here. So I was sitting at my booth a little while ago, and what I'm getting are students and clinical practitioners who have a genuine curiosity about how this technology is going to impact their job. Yeah. mostly AI, but not so.
Yep.
And to me, I know we'll have a lot of discussions on this going forward, but the integration of technology to your role is going to be, to my mind, one of the key challenges we're going to be seeing in the next 2 to 3 years.
Yeah, I agree. No, that's fantastic. And even, from the, that we were talking about my previous guest, the whole discussion around sports medicine, where AI, generative AI,
Yep.
and then even Ovi Mahaley is actually a good friend of mine. I didn't realize he was going to be here, so we chatted. I'm going to have actually on my show probably in the next coming week to kind of pick up on this discussion. But yeah, very impressed with the program that they pulled together. That luncheon discussion was fantastic. But so keeping the kind of the positive momentum, what are you most excited to see about progress that we're in the industry? I mean, we talk about bad in those headlines and newspapers and all that kind of stuff. It's always negative at times. What progress are you most excited to see?
Oh gosh, I tell you what, there's so much to be. What's the term people use these days? White pilled. There's so much to be white pilled about right now in healthcare IT.
Good.
First of all, I mean, if we listen to the keynote speaker where they were talking in a very narrow sense about what elite athletes have to go through to keep them safe, extrapolate that out to anybody who has a knee injury.
There you go. I was saying the same thing.
Right.
Yeah.
anyone who has
A heart condition.
Heart condition.
Yeah, exactly.
There's so much that can be gathered using technology, and to my mind, actually fairly cheaply.
Yeah.
Because sensors
Correct.
and what they're discussing are actually not that expensive. But the information that's gathered from that is invaluable.
Yes.
And that gives me a tremendous amount of optimism going forward to treat even the most common conditions.
Yeah, I mean, you're talking about driving down healthcare costs and also giving a much higher quality of life to us as
100%.
patients. Yeah, not just
100%.
athletes, but us as
100%,
patients.
because we're not guessing anymore.
Exactly.
Right? We're not guessing anymore. And the more we can do this, so personalized medicine has this
you go.
promise
Yeah.
that we're going to be able to give you a protocol that's exactly to you. Before you can even get to that stage, you got to figure out how you got to that condition to begin with. And if AI will do anything, it's the promise of being able to narrow down all those factors that go into that diagnosis.
Yeah, I mean, very simply, taking maybe 100, 1,000 factors, 100 factors, 50 factors, and narrowing it down exactly what it means to you as a patient with your
100%.
specific condition.
100%.
Yeah.
Now we've got to get a couple of things straightened out. Physicians and clinical practitioners have to accept that this is going to be part of their job.
Yeah.
And it goes back to what I said earlier, that the whole challenge is going to be integrating all of this into the way your job is perceived, whether you're an admissions clerk, whether you're a nurse, whether you're a doctor, whether you're a specialist. It's going to impact everybody. And figuring out how that fits into you to make your job, to make who you are better, that's the challenge.
I love it. Fantastic. Spot on. So looking out across the industry a little bit, what are some of the trends, either healthcare trends, digital health trends that you're seeing that we should be ready to navigate or successfully navigate today?
There's a few. The trend toward having personalized diagnostic mechanisms, and by that I mean mobile devices, being able to personally capture information that's yours, that you can then share out, just like the keynote speaker was talking about with those athletes, that the information that they're capturing belongs to them, belongs to their physician. So making sure that something as basic as your Apple Watch that's capturing your heart rate variability, that information belongs to you, that you have control over it, and that you can share it. And that's coming.
Yeah.
Because the benefits to you personally are immense when you have the trust that you can share that information with someone that's going to use that information wisely to treat you.
Yeah, to benefit you and not to benefit them. That was
Exactly.
That was actually one of the conversations.
Exactly. I loved it. I really loved that.
Yeah, they're talking about how their data was used against them, and so you have to be very, very cautious of that. And we've talked about security and privacy, all that for many.
That's table stakes.
Yeah.
Okay, the more technology gets democratized and spread down, the greater the risk for cybersecurity, and that's something we all have to deal with. And there's my own company has built-in capabilities at the processor level, which can assist. But every company, every player in this industry is building upon that capability going forward, and it makes me very optimistic.
Amen. I love it. So, what are a few best practices? So, you're talking, speaking to your peers in the industry, or even some of your providers. What are 2 or 3 best practices that you would say, hey, here's how I would navigate this, or here's what to look for, out there as these trends are emerging?
So if you're a CIO, you really, and I've said this countless times, you have to have a bimodal capability. On the one hand, you've got to make sure that everything is running at a performance level, an SLA that you've agreed to and agreed to with your constituents in the hospital. At the same time, you cannot just rest your laurels on that, because if you're not looking to adopt technology, and it's going to come fast and furious over the next 5 years, and figure out where it fits, you're not doing your job. So number one, make sure your team is aligned with your goals, not just in doing their job, but in looking forward, and have everyone look at ways that their job can be improved with newer technology that's coming in, and making sure that they figure out how to integrate it into the workflow.
Yeah, we've talked about
that's the key. That's the key thing to me.
So thinking beyond today, and this is tough. It's 2 or 3 years down the road. What do we need to be ready to navigate in the future? What do we have to? What trend do we need to be ready for? What do you think?
Bringing healthcare to you. Right now, we take ourselves to a practitioner, to a facility, and we let them tell us what's wrong with us. The trend going forward is being able to use AI as a personal physician's assistant, to be able to say, okay, this is what I have, this is some of the conditions that I'm dealing with, and I have this that's bothering me. What are some of the things this could be? And have that pre-information ready, including possible treatment, so that when you do go to a physician, you're better aware of what they're going to talk to you about. You take away some of the ambiguity that exists right now when I bring myself to a facility or a physician and I don't know what's going on. Having AI as a personal physician's assistant, I think, is something that we're going to see. Maybe not in 3 years, but certainly in 5.
Oh, I actually have not heard that perspective before. I actually totally agree with that, because what I think about is how AI is going to make us a better patient, not only more informed, but more educated, more conversational, and we're going to go in inside for that visit as a much more informed patient with the provider, and having more of my background in my immediate background.
Yes. But right now, you can get all the information you want. We'll go on to Google, take your search engine of choice. You're going to get reams and reams and reams of information, most of which you can't consume, most of which you don't understand.
Right.
The real key here is that when AI becomes your physician's assistant, is to synthesize that in a way that you're going to understand. That's the difference.
Excellent.
In a language that you'll understand, frankly.
There you go.
There's a large percentage of the population in the United States where English is not spoken.
Right.
And being able to have that flexibility, okay, so that when you finally do get an intervention of some kind, you're fully aware of what's being discussed.
It's fantastic, Tony. So we have an extra couple, 3 minutes here. Where does your passion for healthcare come from? Because you're very well versed. You and I just came across each other about 6 months or so ago, but where's your passion come from?
Oh gosh, many ways. So I didn't come into this business directly. I came in on the IT side, on the system engineering side, and got into it by accident when the company I was working for merged with an existing institution that had a clinical practice. And I learned as I went. And for me, the difference came when I actually got to attend emergency rooms, when I actually got to visit and watch what doctors do, when I got to visit Children's Hospital. This becomes more than just an IT play. People's lives are at stake.
Absolutely.
And watching this changes your perspective, and that motivates me every single day.
Yeah, that's actually, I guess I've heard and seen so much. I don't get motivated all the time anymore, because I've been just doing so much of the years. But even that talk at lunch, I absolutely motivated you. And to really understand how healthcare is going to get better for us as patients, us as society, how we can get more efficient. Even the CIOs that have walked through this show today, talking about how, because everybody brings about AI and then we all roll our eyes. However, now we're getting specific examples of how AI is making them more effective, more efficient.
100%.
Now you hear how it's going to make our care better, how us as patients, this is going to get better today. It's already now. This is not the future.
As you look at the 2 football players that were up there, these are guys that didn't have an IT background, didn't have a clinical background, but now they're moving themselves into that business because they've personally experienced it, and now they become the biggest advocates for the value of IT in clinical delivery.
Yeah, and I told Obi, I'm going to give him a platform. I want him getting on you talking.
Yeah, it'd be great.
He'd be great. He's awesome.
Yeah.
What he talks about resonates with all of us, and he's well spoken. And what he was saying, how appreciative of us. And I want to take a moment here to kind of thank our industry as well, because we don't realize what we are doing for society. It is kind of cool. We don't want to pat ourselves on the back, but we are making lives better. We are
100%,
and it's really kind of cool to see how healthcare is coming together.
We are a key part of the care delivery mechanism.
Yeah.
We really are.
The technology
that was
side.
not always true,
Right.
but it is true today.
Yeah, and now we're starting to see it, and even people get up here. One thing also, I'm proud of our industry. Over the past probably 10 years, and almost every guest has brought it up today, collaboration. We are learning to work better together. We're working.
Yes.
We're learning to collaborate better, more succinctly,
Yes.
more effortlessly, and it's coming together. And so now people are actually seeing this, and this collaboration is making healthcare better. It's making better for providers. It's making better for patients. Making it better for institutions. And that's what
Absolutely.
Piedmont said. Northeast Georgia Health System said that today. That perspective is kind of cool. I haven't heard that before.
Yeah, and just the great institutions that have come by. You mentioned Piedmont, but Northside, Emory, a host of others, Wellstar.
Yeah, absolutely. So in the last couple seconds, where are you going after this? What's your next big conference? HLTH?
HLTH
Vegas? Yeah.
in Vegas on the end of the month.
Yeah, 20th of October. And then, because this pro broadcast in the next week or so, and then HIMSS 2025, AMD will be there, correct?
We
in
will
Vegas?
be. We will be. We have a very large presence this year, building upon what we did last year. And we have a lineup of a couple of dozen really good speakers. And so if you're attending the national conference, please come by and visit us.
Absolutely, and I'm sure you'll see my radio show at some point there too. So
Looking forward to it,
all right.
sir.
Thank you, Tony. Appreciate it.
Thank you, sir.
Yeah,
Thank
you
you.
got it. So welcome back to This Just In Radio Show, broadcasting live from the Georgia HIMSS annual conference here in Atlanta, the Health IT capital of America. Just want to say thank you very much to all of my partners and sponsors for today. This Just In Radio Show would not happen without all of you. Certainly want to thank Roberta Mullen from the Healthcare Now radio team, who's producing and broadcasting my show for over 11 years and helped get us as 2024 Podcast of the Year in healthcare. So grateful for that. And obviously my supporters with AWS and Amazon. Roberta's off camera right here, but she's in her Atlantic City gear, which is fantastic. I'm so glad that she came to join us from the beach. Always grateful for Roberta and the whole team there, and certainly the entire Georgia HIMSS board and leadership team to have me here. I think I just committed to them for 2025 annual conference, so it looks like I'll be back next year. But certainly I'm grateful for everybody who helped me put the show on, who brought me here, and certainly made a phenomenal day happen. And also to all my listeners and supporters, please tune in weekdays. My broadcasts are 2:30 p.m. Eastern, 11:30 a.m. Pacific, and you can always track me on LinkedIn at Justin T. Barnes, or track me on Twitter at HIT Advisor, and use the hashtag ThisJustinRadio so we can respond to your comments from the show. If you miss any of this episode or want to hear more, all my shows are on Apple iTunes, SoundCloud, Spotify, Spreaker, TuneIn, iHeartRadio, and even Amazon Music now. So we're all over the place. And also some of the great content we just put out there on justinbarnes.com. I'm on our thought leadership page. But thanks very much, and have a great rest of your day. Take care.